I'm ready for my life to change.
ABC Sundays, American Idol is all new.
Give it your all. Good luck. Come out with the golden ticket.
Let's hear it.
This is a man's world.
I've never seen anything like it.
And a new chapter begins.
We're going to Hollywood.
Carrie Underwood joins Lionel Richie, Luke Bryan, and Ryan Seacrest on American Idol. New Sundays, 8/7 Central on ABC and stream on Hulu.
Welcome to the No One Told Us podcast, where we tell the truth about parenting. And today is such an important topic with someone that is a part of the Solid Starts team. And this is my second interview with someone from Solid Starts. I absolutely love you guys. Today, welcome Dr. Rachael Ruiz. She is a mom of 4, as well as a board-certified general pediatrician and a pediatric gastroenterologist. She completed her graduate at Dartmouth College and doctorate of medicine and pediatrics residency at Vanderbilt. I'm so excited to talk today about all things tummy troubles. This is something that most new parents go through in one form or another, some more serious than others, but I hope that this episode will just help everyone kind of get a sense of what's normal, what's not, and what you can do about it. So, Dr. Ruiz, thank you so much for joining. Welcome to the podcast.
Thank you for having me.
So I just gave like a very quick intro, shared a tiny bit about your background, but I would love to hear a little bit more about what got you kind of interested in this specialty.
Yeah, that's a great question. I, chose pediatrics as a field because I absolutely love kids. And in all honesty, adult feet just kind of gross me out. So the cute little baby feet and toddler feet with those big fat pads, like, I'm a sucker for the best. So that's why I went into pediatrics. And then as far as, subspecializing in gastroenterology, it really was the combination of my love of food and eating, as well as a mixture of procedures that we do and a good mix of patients that you can, fix in one visit to those that you follow throughout their childhood. And, we all know that tummy troubles can really impact your quality of life. And I'm here to help them out. So that's kind of my short story and as far as why I chose pediatric gastroenterology. And then I think after I became a parent myself, I was humbled very quickly.
Aren't we all? Yep. They will bring you to your knees. And even if you're an expert in something, they make you feel like you have no idea what you're doing sometimes.
Yeah, no one follows the book.
No, it's so comforting to hear in so many ways. Today, we're going to be talking about all different types of tummy troubles. So I guess the first question that I have is, how does a parent know? Let's talk about babies first. Mm-hmm. How does a parent know if things are normal or common and when it's maybe time to worry? Because there is such a range of normal for like babies pooping and spitting up and all of that kind of stuff. So I think it's hard to kind of know sometimes if there's something more going on.
Yeah, I think the worry I hear the most about is actually spitting up or a reflux. Mm-hmm. And the really interesting thing is that it is physiologic and super normal for babies around 2 months, really just to start, you see formula coming out their mouth, sometimes their nose. And the biggest question is, 1, is this normal? And 2, when is it not normal? And what can I do about it? So for most babies, they seem unbothered by these events and they continue to eat and they're happy and they're growing fine. And usually we say, let it be. There's a few things we can modify, try to keep them upright after feeds. I was taught to always also counsel on, limiting the amount of feeds, but that is sometimes very hard, especially for nursing parents or a baby that's just really enthusiastic about eating, to just like cut them off after a couple ounces. That can really backfire. And then also just set expectations for the parents. So reflux typically peaks, so it gets worse before it gets better, and it will peak around 4 to 6 months of age, and then it should get better, which is actually interesting because it coincides with with starting solids. And when you think about just physiologically the makeup of the anatomy of a baby, their eating tube or their esophagus, the angle at which they hit the stomach is actually quite, we call it the angle of his, it's actually very open. And so it's really easy for contents to go in and out. Now, when we worry, red flags are always if your baby seems uncomfortable, they're arching their back, they're crying, or if you're worried that, maybe they're aspirating or some of the liquid is going in, into their airway, that is, I would recommend going to your pediatrician right away. And the first thing, I like to think about as far as treatment options, I think some of us think, just start an acid medication and acid blocking medication. And before even that, I would say, okay, if your baby is receiving express breast milk or is nursing, one thing we can try is dairy elimination for the nursing parent. And sometimes that does a trick. If you have a formula-fed baby, sometimes switching formula can also help. And then, working with your doctor, I always recommend, and, the next step after that is, okay, let's consider an acid blocking medication, but knowing that that's not actually going to stop the reflux events from happening. It's just going to make them less painful.
Okay.
And then, of course, if there's any issues with growing, we're worried that the baby's not, growing appropriately, then that's another reason to talk to your pediatrician or a pediatric gastroenterologist.
Yeah. That was going to be my next question is, how important is it for us to pay attention to like the percentiles and things like that? I know people say like, as long as they're following their growth curve, it's fine. But I know parents get super anxious about those numbers. So what can you tell us? Like, how much should we really be paying attention to those things?
I love this question. I am actually obsessed with growth charts. I find them very interesting. And I believe that, we live in this age where data is everything. And we like to, we track everything and we write down everything. And as a parent, that's the first thing that happens when we take our babies or our children in. They get weighed and measured every visit. And if you have, a child on the thinner side, you're worried about, oh my gosh, like your value as a parent, what percentile they're going to be in today? What's the difference? I have patients that write things down. And if you have a child on, the larger end, you're worried like, are they growing too fast? Like, what am I doing something wrong? Am I going to get judged? Yeah. And I'm here to say, I think that growth curves are just part of the story, and that we put way too much emotion and self-worth into those growth charts. And what do I mean by that? I mean, you can't diagnose a child with a problem strictly on their growth chart. A growth chart is just, those dots are just a snapshot in time, and they don't tell the whole story. So say you have a 9-month-old that went from the 50th percentile to the 40th percentile. Like, what does that mean? What I want to first talk about is like, okay, was there any weight loss? And sometimes there is, and there's a good reason. That really, I think these numbers really just should prompt physicians to ask the why, to chase the why, to figure out, okay, what's the story? If a parent tells you, Johnny was sick,
right,
for 2 weeks, then that makes sense,
right?
Versus, or I see it all the time where we see changes in percentiles because the baby starts crawling or they start walking, and we actually see no change in their weight, or sometimes even a little dip. And it's like, okay, tell me what Susie's doing these days. Oh, and parents say, oh, she is nonstop. She's climbing, she's running. Then that's like, okay, perfect. And on the flip side, if we say, no, they have diarrhea 5 times a day and it's loose, they are low energy, then I worry about, nutrition, malabsorption, even if their growth chart looks exactly the same, if that was flat. So all that being said is we put way too much stock into these growth charts, and they're inherently flawed. I have families that, really want their child to be, the 95th percentile because that's an A. And you're like, actually, it's actually not how we measure things. Similarly, I have also parents really shocked because they come see me as a pediatric gastroenterologist with this diagnosis of failure to thrive, referred by their pediatrician. And when you ask the parent, hey, do you have any concerns about the way your child is growing? And sometimes they're actually like, no, I mean, they're small, but she eats everything and keeps up with her peers. And for me, it's like, yes, like that is actually, if your child has enough energy to keep up with their peers and is meeting all of their developmental milestones, I'm not going to put so much stock into their growth charts. And then lastly, we have to also think about genetics too. Mom and dad, are they petite individuals? Or you can also have parents say, oh my gosh, you should see the pictures of me when I was, my child's age.
Right. Okay. That's all really helpful. I think just like knowing the context and not being so obsessed with that one number, right, is just really important. Especially, I think parents, especially first-time parents, get super anxious about this kind of thing. And so I like that you mentioned it's not like an A. It's not a test. You don't get more points for having a baby in the 90s.
Exactly. And it's not a failure too if your baby's in it's not a C that's in the 70s or it changes over time, and that's just growth.
Okay, we're going to take a quick break, and when we come back, we're going to talk about poop. So we'll be right back. Okay, so at the top of the episode, you were talking a little bit about, feeding and reflux and things like that. What if there are issues on the other end? Something I hear a lot is these myths around how often a baby should be pooping. So can you shed some light on that for us? Like, how often should a baby be pooping? What should their poop look like? When is it time to worry?
This is a great question. It's unfortunately, so there's a lot of gray in medicine, and I'm here to embrace it. So it's as much as we want there to be an algorithm we can follow and black and white, there's definitely a spectrum. And so the first thing is that I hear often is that my baby is constipated. And then it really prompts me to ask, okay, why do you think that? And is it because they're not pooping every day? And usually that's where we think about constipation is the frequency of poop. But more so than that, it's also about the caliber of your poop. Mm-hmm. So most babies will poop at least once a day, often several times. We have babies that poop every time they eat. And I would say those babies have a very robust gastrocolic reflex. And basically, it's a natural reflex in our body. When there's food in our tummy, there's a signal that's sent to our brain that says, hey, we got food in here. And then your brain's like, cool, thanks for letting me know. I'm going to send a signal down below to get things moving. So that's why, when even transitions into childhood, when we have, this can cause sometimes problems at the table, right? We start eating and then, got to run to the restroom. Mm-hmm. We also have babies, specifically babies that receive breast milk, that can go days without pooping. And this really freaks parents out. But when they do go, it's soft, it's yellow, mushy, and probably like a blowout. And, this is like, is this normal? And it can be. Well, all this can totally be normal. It can be normal that your baby poops 5 times a day. It can be normal that your baby poops once a week. However, context matters here too. If your baby's belly is really big, and it's, sounds like a watermelon, and they're very just uncomfortable, and they're you notice that they're eating less and they're having issues pooping, that's a reason to bring them in. As pediatricians, there are certain things that we look for. There are certain, the physical exam is really important. And certain things during our anatomies can change and can cause a child not to poop regularly or have difficulty pooping. Anything ranging from, genetic reasons to spinal cord abnormalities, to even masses sometimes, which can really create a lot of anxiety for parents, which is why if, your baby is uncomfortable, to let your physician know. As far as colors go, anything that is not white, black, or red is okay. So I'm talking all the shades of yellow, all the shades of the greens, the browns. If you get any weird colors like a blue or pink, I would say, was there a birthday cake or some sort of like food coloring substance? Yeah. But then there's like, you'll have these, when they start solids, beets, or, I always like the banana poops where you see the black little strings. Dragon fruit, you see the little tiny seeds, and that's another question too. Is it normal to see, undigested food particles in your poop? And it can be. It usually is, especially when starting solids. Mm-hmm. And the reason is, one, a lot of these things that we see, the poop, like the husk or the hull of the corn too, it's undigestible fibers that aren't broken down. They're actually in our poops too. Like if you were to eat dragon fruit and you're inspecting your poop, which most of us adults don't really do, you would notice it's the black speckling of the seeds in there too.
Interesting. Okay.
But when I worry about poops, I worry when I see white poops, like white, I worry about the liver. When I see black, I worry about bleeding from higher up in their digestive tract, maybe like their stomach, or their first portion of their small intestine. And of course, when there's concern for blood. That being said, blackberries, blueberries can cause poop that looks very, very much black. And in those cases, it's always great to snap a pic. You can even bring a diaper. And I'm okay with that, so that we can always smear and check for blood.
Okay, that's a really good thing to know. I actually would have never thought to save the diaper and bring it into the doctor, but that makes total sense if you're worried, right? You've mentioned starting solids, so I would love to know, because I think a lot of parents worry about what's going to happen when they start solids. So what are the kind of top things that you would look for as far as a baby that is ready to start solids, or maybe they're not quite ready yet?
Yeah. So the first thing I look for is interest. Is your baby, when you're eating, are they looking really interested? Like, hey, mama, is that coming my way too? Mm-hmm. Are they putting toys in their mouth? Or are they putting, your parts of your finger in their mouth?
Right,
like
items in their mouth, yeah.
Other items. And then can they sit up with some support? Now, we don't need your baby to sit fully unsupported, but, if you're sitting down on the floor with them and their back is against you, are they able to hold up their head? And if you have those three things, then you are good to go.
Okay. So you're not necessarily looking at a specific age, but more so those signs of readiness.
Yeah. And typically when you think about it, it's around 6 months. So some kids, earlier, if you had a baby that was born a bit prematurely, it might be later. And if, at your 6-month checkup for your baby, if there's any concerns, then I would actually ask your pediatrician, hey, when can I start, or what can I do to help Bobby, get ready?
And then once it is kind of time to go, you get the green light and you're wanting to start experimenting with food. It can be so exciting as a parent. I know lots of us just can't wait for that. What are some things that you'd be looking out for when starting solids that would be kind of a red flag? So maybe signs of an allergy or something like that. Would you see changes in the poop, or would you see other things? What should parents kind of be aware of? Because I know everybody's afraid of allergies and stuff too.
Yeah. So I think the first thing is when starting solids, your poop changes, especially when you start consuming. And for the first thing most of us notice is the smell. Especially again in those babies that receive breast milk, that subtly sweet smell quickly disappears.
Yeah, it sure
and
does.
It's oh wow, you need to take out the trash, or that needs to be bundled up and in the trash can outside immediately.
Yeah.
The smell changes, and then also the frequency can change. So if you had a very reliable pooper, I see it both ways. In fact, my daughter recently started solids, and she actually stopped going poop every day when she started solids initially. And so I was, her frequency decreased. But at the same time, you can see it on the other end where they actually start pooping more. And it can all be normal. However, if you ever see any streaks of blood in your poop, I would be worried about something we see more commonly is cow's milk protein allergy. However, I would not want to delay the introduction of our top allergens, specifically, all the research points to early and sustained introduction. So a lot of us now are more comfortable introducing peanut in the form of like peanut butter, mixed into oatmeal or spread thinly on a piece of toast or mixed in pancake batter. But then I see commonly that then it's just kind of forgotten, like, oh, check mark done. We did it.
Never
no
do it
allergic,
again. Yeah.
Never, no allergic reaction. We're good. And like, no, we got to keep it up at least, 1 to 2 times a week. So that goes with, I would say, with peanuts and eggs, milk products, dairy, and then depending on the family too, fish and fish and other nuts. But as far as looking for an allergic reaction, it, commonly doesn't. It can happen really. Allergic reactions can really happen anytime after the first introduction. So again, another misnomer is, oh, I've been, introducing, peanuts, and 2 times we're good. It's never going to happen. The likelihood is decreased. But it can still theoretically happen. So looking at an immediate allergic reaction to food, you're worried about vomiting, difficulty breathing. Sometimes we'll see rash come into play. However, I will also say a lot of, we can see contact rashes or contact dermatitis just from, especially for babies that self-feed, when they start like rubbing their eyes or, food gets everywhere. You're like, is that an allergic reaction?
Yeah.
With egg, a tomato, it could be anything, eggplant. You're like, actually, usually when the rash it follows the distribution of where the food touched.
Right. Right.
That's reassuring. Again, I would also, though, take pictures and videos and monitor. You can always bring that information back to your pediatrician. And then lastly, sometimes there's delayed allergic reactions, very uncommon. A common culprit, for example, could be sweet potato, but this would be several hours after eating it. You would have these like violent episodes of vomiting and diarrhea, and your baby could become very like limp or lethargic. That'd be an emergency. Take them in.
Okay.
Very, very uncommon. But more commonly, what I hear as a pediatrician is, what to start with. Like, what should I start with?
Right. Yeah. Like, what are the safest foods to start with, I'm sure, is what most parents wonder.
And to that, I would say, what do you guys eat at home? Because the best things, honestly, are what I want to focus on your family foods. I really try to stay away in counseling families to offer a separate meal than baby, because when you think about it, especially when your child's in the toddler age and, they're going through a picky eating phase or a selective phase, if you've started their meals separately, eating different foods from the family, how do you bring them? It's harder to bring them back into the table as opposed to just starting with a family meal. Now, does it mean that you're giving them everything? No. Does it mean that you have to modify? Yes. And what do I mean by that? Say your family really likes stir fry and mixture of veggies with meat and rice. I would say, have your broccoli or your snap pea like a bigger piece. Not the small, tiny pieces. We have to remember when babies start eating, they're very much like using their whole hand. And then put, 1 or 2 of those on their plate. And that's how you just include them early on. But things to, be aware of is starting, introducing your allergy, your top allergens early, as well as, I will say as a pediatrician, sources of iron. So whether that is meat or beans, so whether it's plant-based or meat-based, that is really important because their iron stores are diminishing around that 6 month of age.
Yep. And iron can be so helpful for sleep too. I'm talking about iron constantly, like till I'm blue in the face, that it's so important.
I love a juicy meatball.
Right? I think my middle daughter's first food was like sucking on a huge like bone of steak. She was just in heaven. And the Solid Starts app is so helpful with figuring those things out too. And I'm sure the book is going to go into it even more. And we'll talk a bit more about the book at the end. But yeah, I mean, I think sometimes parents just they've never been exposed to this way of feeding, because when we were growing up in like the 80s and 90s, we were spoon-fed from like a Gerber jar. But yeah, my kids' favorite first food was those huge chunks of broccoli. They just absolutely loved it. And my parents looked at me like I was insane and they could not believe it, but they loved it. And now they're good eaters. We're going to take one more quick break. And when we come back, we're going to talk a little bit about something you just mentioned, which is the toddler selectiveness or pickiness. So we'll be right back. We are back with Dr. Ruiz, and I would love to talk a little bit more about the toddler stage now. One of the biggest things that I hear from parents and just my own experience as a parent has been that selectiveness or that pickiness in toddlers. So I know some of it's normal and, we have to just kind of like get through it and be patient with them. And there are all different things that we can do. But I guess, how do you know when it's something that you might want more support with? Like, how much selectiveness is normal and what can parents do about it?
I think this is a great question. I actually, I even have a feeding clinic, actually, where we see, the children that need that extra support. And it can be hard to figure out, especially if you're a first-time parent, because that, stage of neophobia or that, toddler phase, most of us can ride it out, but it's really easy to also give in to, or to fall into a habit of, again, making the separate meals, where you're doing, like the mac and cheese for little Maggie, and you yourself are making this other dish, and that becomes the new normal. But what I like to counsel families on is giving choices to your child. So if they are, fans of cheese and they're going to be upset that there's not cheese at the table in the form of like mac and cheese, one thing, as far as getting through that hump is, okay, how can we make this better? Like, what is this missing? Do we need cheese on our broccoli? Is that what we need? So really to engage your child, remove the pressure from eating and consumption. Like, please just try it one more bite, because we can really create oral aversion or a very negative association with meals. And that can become stronger over time, to the point where I get worried when our children are only eating a very select, the parents can count on their hand how many foods they eat. Specifically, if we notice, they're avoiding all meat and all soft things. They're only eating crunchy, and it has to be, and becoming very rigid. It has to be pizza from Domino's and chicken McNuggets from McDonald's, and that's it. And then I'm worrying about not only nutrition, I begin to worry about nutrition, but also, are we going down this rabbit hole where we actually do need extra support? Like, how can we send a lifeline, a lifeboat to this family and this patient before it becomes something that, just blossoms into a bunch of stress and negative associations with food. Another strategy we like to employ is incorporating your child into the meal preparation, or, like, hey, mommy is thinking about rice or pasta tonight. Like, which one should we do? And really just giving them the power of choice. And then just the gentle boundaries, knowing that there's going to be days, we talk about this all the time at Solid Starts, there's the short game and the long game. The short game is, I got to get through today. Mommy had a hard day at work. I just want the day to end and you in bed. Then
right.
Those are the short game days. And then the long game days is like, I'm feeling refreshed and we're going to talk about gentle boundaries and, it's okay that you don't eat a robust meal. I'm going to let it go. and we'll just reassess tomorrow.
That's so helpful to remember too, that like we don't need to be on 100% of the time. Like sometimes we can pick our battles because it's hard to commit to, that like perfectly well-rounded meal where we're going to expose them to new things and all of that like every single night. It's just not always possible.
Life is not Instagram, and right. Sometimes life is lifing.
Yes.
And the great thing, and the great thing too is that our kids are super resilient. They're super resilient.
Yeah.
And it's a matter of, consistency and love. And I think not putting all of our energy into one meal because it's not going to make or break the child or your day.
Yeah. And then are there different strategies? Because I know for some kids, it's more of like a sensory thing, like especially if they're neurodivergent. Or have, sensory issues. So are there different strategies that you would use for them versus kids who are more neurotypical?
Yeah. So I mentioned my feeding clinic that I work in, and I would say almost 95% of the kids are neurodivergent. And we see typical story is, they eat everything. And then one day, all of a sudden, it becomes very narrow. And we see different patterns of, some kids like crunchy, or it's really spicy. And that's, I would say, if I had a neurodivergent child that has, 5 foods that they eat, it's really, really important, or 10, or, there's any parental concerns, especially when we're eating completely separate from the family meal and they can go several meals without eating, is when, or there's concerns about growth, whether they're growing too rapidly or not enough. Or I also see when GI issues really become pronounced, specifically constipation as another one. Then it's really important to advocate for your child and yourself and go to your pediatrician and ask for that, referral to get that support, because what I see, it takes longer. And
the general pediatrician doesn't have the time to go through all of that with you. Like you just sometimes need more of a specialty. Yeah.
And so, sometimes as, during these feeding sessions, we're going to just, how can a child tolerate even certain smells? So you're not even focusing on the actual consumption. It takes a while to even get to the consumption. Tolerating the smells, or like, can you touch it? Can we lick it? Can you kiss it? Like it's
it's like exposure therapy.
Yes.
And I also think, correct me if I'm wrong, but like neurotypical kids often too, like this happened with a couple of my own kids, they would eat anything as babies. Like they would try anything. They were like, I thought I was the best at baby-led weaning. I was just like, oh my gosh, I'm so good at this. Like my kids eat anything. They're so adventurous. And then once they get older, they're like refusing a lot more things. And they do have many more opinions on what they will and won't eat. Is that pretty typical? And will it go back? Like, will they become an adventurous eater again?
Yeah, 100%. This is normal too. I think one way we could help mitigate this is, when to serve your family foods as you eat them, as much as possible when they're younger. So, when we talk about like broccoli, serving the broccoli as you eat it versus cutting it super small or mixing it. I see it blended in pasta sauces and like. You're getting it from you're consuming it from a nutrition standpoint. However, when they see broccoli, they're going to say otherwise.
They don't like it. Yeah.
So that's like one strategy. But also, we do have preferences as well. Yeah. I remember I absolutely hated Brussels sprouts. Hated it.
That's fair.
Yeah. Come to find out, it was if my mom steamed them and put some salt on them, and that was just now I can. If I put a ton of olive oil and salt and Parmesan cheese and I put it and roast it.
Some aioli on the side. Yeah.
Right? Like that's what it was lacking.
Right.
So it's normal to have some preferences. The other thing I've noticed too is, you have the peer pressure. Mm-hmm. Their peers saying, I get this, with my 7-year-old. She sometimes takes lunch, sometimes she does school lunch. And sometimes when our lunches come back untouched, it's like, tell me about your day today. And, were you just playing during lunchtime, or, someone commented on your food? It's different. She likes to bring leftovers. And it was like, that can affect it. Or even I've noticed with as they're losing their teeth, my oldest, again, I'll use her as an example, she's having a hard time with meat.
Right. That makes sense. Yeah.
And it wasn't until I was like, hey, how can we make this better for you? Like, do you need it? Do we need to cut it? Like, is it the flavor? And she's like, my tooth is loose and I don't really want to bite into the drumstick. And you're like,
don't blame her. That makes sense. Yeah. And I think it's important too to just have that attitude of like, kids are always changing and we have to be flexible sometimes, and they'll come back around sometimes and other times not, but that's okay. The last thing I wanted to ask you about before we wrap up, and I do want to talk about the book at the end too. So another thing that can come up with the toddler stage is obviously potty training. So I know we could do a whole other episode fully on just this, but I guess what would be some of like the top maybe misconceptions or the top worries that you hear in your office about potty training, and what are your what's your kind of go-to approach for parents who are asking, like, what method should I use or how should I do this?
So in the same vein as, baby-led weaning or finger food first, I'm a big proponent on toddler-led potty training.
Yeah.
And, what do I mean by that is I look for the readiness signs. And like with feeding, I believe we should model how to use the restroom. So it's like a little awkward at first, but, it's hard for your child to learn how to use the restroom without seeing it in action.
I mean, let's be honest, they want to follow us into the bathroom anyway, so you may as well just let them. Sometimes see what it's all about.
Look, all 4 of you are in here. Like, we've mommy needs some space.
Right? I know.
So the modeling is one. And then I am also, when they can voice that they're wet or they're dirty, that's a good time to start. Okay, let's talk about it. I like to utilize, again, I mentioned the gastrocolic reflex. So 15 to 30 minutes after meals, let's go sit on the potty, make it a routine. And not a I see a mistake all the time. Oh, I had Susie sit on the toilet for 15 minutes and I gave her an iPad. I'm like, no.
Yeah, no.
No, let's not do that. Actually, I just say a couple minutes.
Yeah.
A couple minutes, something happens, great. If it doesn't, no worries, we keep it moving. And then kids respond differently to reward systems. They want to feel proud. So I had some of my kids really respond well to stickers. I had to up the ante as I kept having more kids. And the other, it's like, oh, I want an episode.
The fourth one, yeah.
Episode of Bluey.
Perfect.
And I want two episodes if I go poop. I'm like, deal.
Sounds good to me.
And also it's different for every child. So, I have, some will get the concept really well and, two after, or shortly after done. Others, it's 3 or later. And I really like to stay away from the shaming aspect too. Getting upset, because one, accident's happened, and two, it's just that body awareness can take some kids longer. But the other thing I notice as a GI doctor is that children will withhold their poop. So I could see, and this can exacerbate constipation. And I really, if we have any hard stools or we have straining, then that's when I'm like, let's maximize the constipation, the stool regimen, because I don't want your child to have a negative association with pooping. Because if every time they poop, it hurts, they're going to say, oh, I'm not going to poop again.
Yeah, it's going to be scary. It makes sense.
And it's going to be scary.
Yeah. Okay, well, that's all really helpful to know. I agree. I mean, I think we did our 2 kids closer to 2.5, 2.75, and it was so chill and low stress because they were just kind of ready by that age. I think a lot of parents think they have to do it at 20 months or at, these arbitrary ages, and they think that it's only supposed to take 3 days. And if that's not how it goes, that they totally failed. And it just puts so much pressure on the kid too. And it's it's just so counterintuitive to do it that way, I think.
I agree.
So, yeah. Okay. So I'm glad to hear that because I haven't done it with she's not quite 2.5 yet. And I feel like she's almost ready, but I haven't done it yet. And I'm like, are we waiting too long? But that just made me feel better.
You can always, you see and you reassess, and it helps when they have older siblings too.
For sure. Yeah. Because they get all of that extra modeling. This has been such an informative conversation. I appreciate you joining so much. And the Solid Starts book for babies, How to Introduce Solid Food to Babies and Raise Happy Eaters, is being released April 1st, which is so exciting. What can you tell us about your role in the book and what you're most excited for?
I just love that this book was a labor of love and a multidisciplinary effort with me as a pediatrician. We have our pediatric allergist. We have our occupational therapist, our feeding therapist, Kevin Carey, Benus, our dietitian. And so really capturing every question from all of our respective expertise. It creates, I think, a very well-rounded book that takes you from, the history of baby food and why, most of us were spoon-fed purees to what the research is saying, talks to you about, if you're concerned about choking, it addresses that. If you want to learn how to introduce a cup or what things you need, it has that. You can really use it as a choose your own adventure. You don't have to read the book cover to cover. I feel like there's a lot of thought come into this book. And if you love food and you're or you want to learn more about feeding a baby, I think this book is, for you. And I'm just so proud of this book and just our team in general.
Amazing. I am so excited. It's going to be, like you said, just the most well-rounded book on this topic that's going to be available. And I cannot wait to get my hands on it and for everybody else to see it too. Thanks again so much for joining us, Dr. Ruiz. Where can people find you and connect with you?
LinkedIn and Instagram are my best right now. I'm working on my website currently.
Cool. Oh, that's always fun. Love that. And you have 3 kids or 4 kids and a job, so you have nothing else going on but to build your website. Oh, actually, speaking of your kids, last question. I almost forgot to ask you this. What is something that no one told you about becoming a parent that you wish you had known?
The importance of mental health days.
Yes.
I love my kids to death. I love them. I'm the default parent. I miss them when they're asleep, but sometimes just like a few hours, whether that's me just going to Costco by myself and listening to my favorite audiobook and getting a latte on the way and just giving me that space. Helps me kind of show up.
Yes, that makes total sense. That's so important. Well, thanks again for joining us, and I hope you have a great rest of your day and a successful book launch. I'm so excited to see it and to support you guys. So I really appreciate you coming on and talking with us about all of this.
Thank you. It's my pleasure. Anytime.
Are you a parent in need of a laugh and a little escape? Look no further. Parenting is a Joke is the podcast you've been waiting for. Hey, I'm Ophira Eisenberg. I'm a stand-up comic and parent. And each week I chat with one of my top comedian pals who, just like you, are juggling careers, busy lives and schedules, and raising a family. You can expect candid stories, hilarious mishaps that happen on stage and at home, and just a lot of laughs. There's no expert advice here. Well, actually, sometimes a good idea does sneak its way in, but mostly just pure, relatable fun to remind you that we're all in this parenting adventure together. New episodes of Parenting is a Joke drop every Tuesday, so tune in, get ready to laugh, unwind, and maybe even feel a little bit better about your own parenting. Because sometimes that's exactly what your therapist, pediatrician, and bartender ordered. Subscribe now on your favorite podcast platform.